why did we do a survey? Why did we go through all of this? Why did we ask so many questions? Well, quite simply because we've had strategies and there's legislation being brought in as well. We then had some sort of pandemic that put a stop to a lot of our work. But then we thought, well, we need to actually find out what people think. Because unless we're all willing to have a conversation about disability, about health conditions, unless we're all willing to actually work together in partnership to decide the way forwards, then that legislation and those strategies are all just words on a piece of paper that will sit on someone's desk. So the whole purpose of this survey was to get all of us talking, was to get all of us joining in and educating each other about what our disability is. How can we make life more inclusive for everyone in Jersey? So I'm going to spend the next 30 minutes going through the results or the findings of the survey. But most importantly, I'm going to show you the words from the people behind the survey. I'm also going to chip in with some of my own personal anecdotes and experiences. The survey then was an independent survey performed by 4 Insights. They used their panel and we also promoted it across the island via social media for the government of Jersey, which has a large following. However, the questions we were asking were deliberately provocative. They were deliberately challenging because we wanted to look at the myths, uncover them. What are the myths about disability inclusion? We wanted to scratch the surface and find out what are people's attitudes towards disability so that we can look at those, shine a light on those and turn it away from being a taboo and make it so that we can move forwards together. First of all, I'm going to tell you who filled in the survey. I won't pretend that I'm a statistician, one of those. I won't pretend that I'm one of those. I'm just going to tell you in layman's terms what we received and who filled it in. So we had 768 data sets that we've achieved, which I'm told is a great statistical representative control. The age groups was a brilliant spread. So as you can see there, we covered across all age groups from about 16 up with a nice selection. There's a gender breakdown there for you too, to help you understand kind of what that representation was. We also asked people what their employment was as well, because again, some of the myths that I hear are that disabled people generally are out of work. Well, actually, we've got people who answered these questions that have a disability and are in work as well, which is going to scratch back the myths. Let's look at the attitudes, let's look at the results. But it wasn't just people with disabilities that were filling this out. Here's the breakdown of that. Those people that identify themselves as having disabilities against those that identify as not having a disability. Rather than me now just keep showing you lots of slides with stats and numbers on, we've picked out some key themes to cover. First key theme is that 81% believe that there's prejudice in Jersey against people with long-term health conditions or people with disabilities. 81% of us in Jersey believe that there is prejudice. That's a stunning fact to take away, if nothing else. But I like to flip things on the head. I'm very positive. I work in education. It's all about positives and ways forwards whenever you even get a negative in front of you. Actually, that's 81% of people who are willing to admit that and are looking for a way forwards, a way to tackle this. That finding is higher than the UK's. Here's the breakdown of what people said. So you can see the answer is yes, a lot, a little, hardly any, none, don't know. How it breaks down. Most of these key themes we've tried to split out so you can see the differences, or if there was any difference, between how people with disabilities answered them compared to how people without disabilities answered them. 45% of people with a disability that answered this survey said yes, a lot, compared to 28% of people without a disability that filled in the survey thought that yes, a lot. I'm going to point these out because, again, I work in education, and to me, a lot of this that we've found with these survey results is that it's all about educating each other. All of us educating each other about disabilities, the different forms of disabilities, what we can all do, the differences we can all make individually to actually make life more inclusive. What did people say about that? So the what did people say section after every theme is from the free text part of the survey where we ask people for their comments and thoughts. And then what we've done is I've then had a look at them with my incredible insight and actually picked out, okay, this was a comment about this key theme. Some people cause issues for disabled people, not deliberately, but simply by not realising the impact of their actions. What do you think about that? I think that's possibly the most eloquent and well-put comment I've ever heard about that subject, because it's true. Even myself, you know. When I was asked to be honoured actually, to be asked to be the face of this campaign, I told a friend of mine who has an invisible disability, and the first thing that she said to me was, well, they would get someone like you, wouldn't they? So it's all of us. We all have some sort of way of excluding people or putting barriers or assumptions in front of ourselves, just because we don't know enough, we don't understand. Next quote was, disability and inclusion courses should be mandatory in workplaces and schools. Fantastic. How can we learn if we don't know? How can we find out and learn if people aren't willing to teach us and willing to show us? That starts in school, but it's for lifelong learning as well, for all of us. Final comment on this from the people that filled in the survey was, the understanding of mental health and its disability connections, as well as the treatment of people with these type of disabilities, is awful in Jersey. This might be one person's opinion, but it's that one person we want to evolve, and we want to all work together to change so we don't get anyone thinking that in the future. Next theme then. Non-visual disabilities are acknowledged, with most islanders disagreeing with disability being something they can see. That's brilliant. That's how the stats work out from it. So one, I'll have to keep reading them, is completely against my understanding. 54% of people that filled in the survey were completely against that. Yeah? The disabilities are not just visual things. It's not just people with prosthetic limbs and bits of metal sticking out of them. It's not just people in wheelchairs. There are invisible with disabilities as well. This is amazing because for me, and this is a tentative connection, me not being a technical person that looks at data and ties it all together, but my tentative connection is we have already started the learning, because in a lot of the campaign promotional material to put this survey out there, we mentioned it's not just about visible disabilities. We started the learning process just by having this conversation. We're already on the track to a more inclusive Jersey. How did that break down between people with disabilities answering this survey and people without? Actually, there's no difference. They all felt the same. So what did people say about that statement? Non-physical, invisible disabilities tend to be underestimated. Focus is applied primarily to visible physical disabilities. Right, come on. Just because a disability cannot be seen does not mean it should be ignored. Our next theme. Schools, education and learning are regarded as the most accessible, closely followed by private and public health services. Now yes, those of you paying attention will have noticed that I've immediately moved on to accessibility. So I've just talked about invisible disabilities, and it's not just always about, but actually when we go to accessibility, we all, I'm sure, jump to this ramp that's down there, or widened doorways. But what does that really mean, accessibility for invisible disabilities, or for ones that are non-visual? So schools and education and learning regarded as the most accessible, followed close behind by private and public health services, which is great. Hospitality, restaurants, pubs and clubs rated the least accessible here in Jersey, closely followed by sports, gyms and recreation. How many of us like to go to restaurants, pubs, to the gym? What about if we couldn't get there ourselves, or if it wasn't inclusive for us? How difficult would that be? I'm going to take some time now going through all of the different options to do with the accessibility question. Because I'm going to do that, I'm going to put the question up here so that we all remember what it was that we asked. On a scale of 1 to 5, how accessible are the following aspects of Jersey? 1 being completely inaccessible and 5 being completely accessible. So I'm going to go through all the categories for you. Schools, education and learning, we've already said this was one of the most accessible. If we take a look on there, we can see that 1 is completely inaccessible, 5 is completely accessible. For those people answering 1 and 2 on the accessibility of schools, 21% of the people who have disabilities answered 1 or 2. And only 11% of people who do not have a disability answered 1 or 2. Shopping and retail. Now you can see straight away from the figures there that this is quite an even spread across. Shopping and retail is regarded as the most average in terms of accessibility when we were comparing it to the two different groups that I'm talking about, people with disabilities and people without disabilities. We still have people there, 25 to 30% saying it was inaccessible. Government services and facilities. Now, being a government employee, I was quite keen for this one to be good and to be accessible for all. And actually, you know what? Because let's face it, we all need to be able to access government services. Answering one as in completely inaccessible, only 12% of the people who have a disability that filled in this survey said it was completely accessible. That's an excellent figure, 12%. 3% of people who do not have disabilities answered that. Public transport. Again, looking at the score straight away, we can see actually our public transport comes off quite well with this survey. 26.4% of people with disabilities said it was completely accessible or on the way to it, as opposed to 36% of people without disabilities. Hospitality, restaurants, pubs and clubs. So from the theme, we know this is a difficult one. It's one that has been highlighted accessible. We know that we have old buildings in Jersey if we're talking about accessibility as in ramps and doors, but what about everything else? 44% of people with disabilities that answered this survey said that it was completely inaccessible or inaccessible. That's nearly 50% of people with disabilities that answered this survey saying they couldn't access pubs, restaurants and clubs. But 40% of people without disabilities that answered this survey also said the same. So although we're talking about we want to all learn together, we want to all move together, there are points where actually our opinion is already there on the same level with each other. Sports, gyms and recreational facilities. Answering completely inaccessible was 13% of the people who have a disability that answered this, followed by 5.9% of people who do not have a disability. And you can see by the percentages there underneath too, that 29% thought they were inaccessible. Your place of work. If we're going to be working, we need to all be able to access it. Now, the pandemic was brilliant for one thing, and that was how much we embraced digital and virtual working, being able to work from home, turning our homes into our workplace. If I have a disability and I live at home, it will be accessible to me. That opens a door of world of work to people that possibly have not been able to access it before. The results from this were pretty good. 33% of people with disabilities answering 4 to 5, so completely accessible. A third of people that answered this survey with disabilities thought their workplace was completely accessible. 46% of people who do not have disabilities thought they were completely accessible. Talked a lot about learning and talked a lot about simple things that we could do. And when we're talking about the workplaces, it is simple things that we can do. In fact, everything we've talked about is simple. There are simple solutions. We don't have to always think about lots of money. And I'll give you an example. Where I work, having one hand, I have to get through 3 doors, 3 fire doors, you know, the big ones, the heavy ones that close shop. Now, if I go and get myself a coffee, heaven forbid if I go and get someone else a coffee as well, I cannot get back to my desk. Now, the simple solution would be, is a nice little shelf, not too imposing, next to every door. Then whether it's a coffee, whether it's my laptop, whether it's whatever it is I'm carrying, I can put it down to open the door. Simple, it costs about £5. I can't say much though because I'm the budget holder and I could have actually done that. What people said about all of those accessibility questions that we put in there was, it doesn't take much effort to make premises and services accessible to everyone, just the will to do it. Our next thing, more than 70% of Irelanders perceive that people are disabled by barriers and inaccessible locations, services and daily activities due to the attitudes of society and the way things are designed. I had to read that several times before I understood it. Probably not very bright, you've probably all got it already, but it's due to the attitudes of society and the way things are designed. Now I know you might be thinking that's negative, but to me that's brilliant, that's positive, because one of the easiest things to change is people's attitudes through education and learning. If they were telling us it's down to all the old buildings in Jersey and we've got to knock them all down and rebuild them all step by step, Garen and Rock would be rubbing their hands, but the rest of us will be thinking this is going to take a long time and a lot of money. But if it's down to attitudes and belief of society, We can all work together. We are all responsible for our own attitudes and educating people around us and educating each other. There's the spread of answers for that one. 36% of 17 to 24-year-olds voted for 10, which was completely matches my understanding. 22%, 55 to 74-year-olds voted for 10. What people said on that subject. Non-disabled people should adapt to enable disabled benefits to fit in. It is not a choice to be disabled in any way, and more should be done to allow for the inclusivity of disabled people. I'm going to come back to that point in a minute on my next slide. Another quote said, I have autism, and I have talents as many do with autism. A world that allows us to flourish would be great, just by changing attitudes and beliefs of society. It would be great. Next thing, people with a disability were considered as productive as non-disabled people in the majority. This is brilliant. I'd have been very worried if it had gone largely the other way. However, when I was 16 years old and was employed at Lloyds Bank as a data inputter, I was inputting data, and my manager said to me, well, we'll have to change your targets. I said, what is that? He said, well, you've only got one hand. You can't type as fast as everyone else. You go half the speed, so we'll have to halve your targets. Now, foolishly, as a 16-year-old, I probably should have said, yeah, that's fine. Absolutely fine. At least it's bonus-related pay, great. What I did just point out to them was it's not about disability, it's not about work, it's actually about skill. So I changed it to a typing contest. And I could type much faster with one hand than he could with two hands. So it is there. People do think disabled people are less productive than able-bodied people. However, not in Jersey. So there was 3 questions here. I've left them together just because it's nice to lump them here. So we've got disabled people in general are not as productive as non-disabled people. Look at that, strongly disagree. It's excellent. Again, already that is an attitude out there in Jersey. We can jump on that, we can go along with that and work together because there's people out there who believe already. The next question was, we should make everything accessible to all regardless of cost. Now look, strongly agree and agree. I was so surprised by that, mainly because of the words regardless of cost. Because I would have thought that would have put people off saying agree or strongly agree, but it hasn't. Again, there's the desire there. Everyone is already wanting to work together to make Jersey more inclusive. We can see the benefits. The final question that related to this was, disabled people need to adapt to fit in. Disabled people need to adapt to fit in. Okay? Here's a controversial for you. I agree. My ethos has always been that it's my disability, I will own it, I will change for what's going on around me. However, before you all start throwing things at me, even I have to admit that there is also something called the impossible. Not the I can't, not that I can't do this, because quite often if I'm saying that, what I really mean is I don't really want to, I'm a bit bored and I can't be bothered. It's the impossible. So even with someone like myself, I've got to admit there's impossible things that I cannot do. And I need others to step in and adapt to make the environment inclusive. So actually, should we be all adapting as disabled people to the things around us? Or should actually we be all working in partnership, meeting halfway, or 75% or 25% of the way, whatever it takes to help all of us with disabilities to be able to become more inclusive and be able to get more involved. To have all of us in Jersey more inclusive. I might need security to walk me to my car after that. 76% of the votes for strongly agree on if disabled people are as productive came from people who are disabled. Answering strongly disagree on disabled people needing to adapt. 51% of the people with disabilities answered strongly disagree. 43% of non-disabled people answered strongly agree. Excellent. It's another positive fact that we can work on from this survey. The next thing, a clear need was identified for more training and learning about disabilities. I've been threading this throughout. because it is true, and it came out quite glaringly, even according to the people that know what they're doing analysing these surveys, that actually this was a common thread throughout. During the free text question, all these answers were put in, and those who have used these sort of word arts before, is the bigger the letters, the more often they were said. Now this was from everyone. Anyone that filled in the survey, this is what the results were. So the bigger the letters, so there's no support regarding career and future. Shortage of disabled access in retail buildings, more learning and training on disabilities required. That was everyone's feedback. The same if we just filter out and look at the people with disabilities, what they said. More training, learning on disabilities required. Again, is one of the largest ones there. It's the theme throughout, it's the thing we can change the quickest, it's the thing we can all take responsibility for doing. It's the thing we can all help to contribute towards as this turns into an action plan for Jersey to be able to move forwards to make Jersey more inclusive. That's it. Hopefully, this is just the start of the conversation and we can move forwards with this. I'd like to thank all of you for listening to me, and I'll hand you back to Nelson. Thank you.